it's just a huge, huge honor today to be podcast interviewing pediatric dentist Dr. Roger Lucas, all the way from Seattle, Washington. And I love Roger so much because he hates the Seattle Seahawks and he only roots for the Arizona Cardinals.
Go Hawks.
Every single game. Here's his bio. Do you want to have less moms crying in front of you because you just diagnosed 8 cavities in their 5-year-old child? Do you want to perform less invasive sedations? Do you want to make sure you and your own children are cavity-free, even if you had bad genetics? Dr. Lucas can show you how it is easier than you think. Dr. Lucas is a regular dental contributor on King 5 News. He is the author of the book, More Chocolate, No Cavities, How Diet Can Help Keep Your Kids Cavity-Free. He is a national speaker on cavity prevention and managing your clinical practice. He is a board-certified pediatric dentist and winner of Best Kids Dentist Award by Parent Map for 6 years in a row. He's also is a struggling children's music singer. Man, thank you so much. I just want to start with a little, on Dental Town, we have like 350 online CE courses. The pediatric dentist courses are number like 1, 2, and 3. The Affordable Health Care Act made health insurance for kids under 12 cover dental. A lot of people are estimating there's like an extra 10 million people now are going to dental services. Pediatric dentistry, and then you had in 2007, you had the echo boom, where the millennials dropped 4.7 million babies. So pediatric dentistry is exploding right now.
Oh, yeah, that's the funny thing is kids keep coming. They keep getting created. It's pretty pretty awesome. And I think, Howard, one thing you've talked about before, because I'm an avid listener of our podcast, so thanks for having me, is just because we're going to talk about preventing cavities. And I think there's this unsaid thing that we think, oh, my goodness, if I teach my patients how to prevent cavities, I'm not going to have enough production. I'm going to lose income. Maybe dentists don't say that, but you talk about having a mindset of abundance. And that's how I look at it. We could tell everybody in the world how to get 0 cavities. 1, not everyone's going to listen. But 2, there's way more cavities than we can fix. So the more we can get the education message out, the better. And also what I find is when parents know that I'm in their best interests, when I'm conservative, when I'm trying to help them, they appreciate me more. They refer more friends. So I'm more successful anyway. So anyway, I just want to mention that before we talk about how to prevent cavities and make it easy, because I do think that's the kind of spoken rule that some dentists think. Not everyone, but some.
So let's start at the very beginning. These bugs that cause cavities, were these babies born with those bugs, or did somebody infect them?
So that's the common thinking in dental school is that, well, of course, it's true and not true, right? Caries is a transmissible disease, and when I was trained 10 years ago, and the current thought process is it's an infectious disease. We can't control the bacteria. Once you get that, there's nothing in your control, and that's a very reactive mindset where we can do some stuff, and that's the thing that I was annoyed with when I had my own daughter. I was diagnosing cavities in parents. They would come to see me for a few years. We'd take our first bite wings. They'd have 8 cavities. They'd be crying in front of me because those are the parents that were trying. Of course, there's the parents that not trying. Those ones I didn't feel as bad for. I felt bad for the kid. But the parents that did, they said, I did everything it told me. We did fluoride, we brushed, we had no sugar, we avoided candy. And all those cavities, we just kind of blame on genetics or the infectious process. But when I had a kid of my own, I go, that's not good enough. I don't want my kid to get 8 cavities and have no idea why. Because guess what? I was fixing cavities on other dentist kids. They'd get the in between E and F. And so we'd have to fix an interproximal between E and F on a 3-year-old. And the dentist was going, I don't know what's going on. So that's the thing is now what I preach, I call it, my patients all know how to get 0 cavities, and we call it common sense. It's not common. It's almost so simple. You go, well, no, that's too simple. I know all the 100 variables, but that's my point. If we have 100 variables to focus on, and we want to teach parents what to do, what are the top 3 to focus on to get the most bang for the buck? Because we could talk about 100 things all day. There's so many things to talk about. And but here's the basics things. After 4 years of research, looking up hundreds of articles, I asked myself this question: can bacteria make lactic acid without carbohydrates next to them? And I think when I trained from dental school, I kind of thought, well, no, they can't. But in the back of my mind, I go, well, maybe they can, because I don't know where all these cavities are coming from. But when you look at it, there's no explanation in 50 years of research that I kept looking you have to have carbohydrate next to bacteria to make lactic acid, and you have to get the pH below 5.5 on the enamel to make it weaken. So you focus on the carbohydrates, the frequency, and the stickiness as a number one variable, and then you can control the bacteria. So that, I guess the answer is yes and no. Of course, you have worse bacteria from your mom, but my point is you change the frequency of mom snacking on carbohydrates. Maybe mom's snacking on carbohydrates all day, so that's why she has the bad bacteria. You switch mom's diet, you switch kids' diet, and now all of a sudden the bacteria turns to better. And there's lots of in vitro studies. It's hard to test this on humans, as you guys know. But in the laboratory setting, when you start off with a clean slate, if you have very frequent carbohydrates, you get the worst bacteria, because Streptococcus mutans needs frequent sugar to make those peptidoglycans to make itself sticky. And in fact, if you remove all the sugar, Streptococcus mutans just falls off the agar plate. Once it can't make that the peptidoglycan to make itself sticky, it can't even attach. So that's my point is, instead of looking at the microbiome as a static thing, we do a lot of research where we test it. We go, oh, this bacteria is bad, this bacteria is bad. They need to do tests where they change their habits at home and then test it again, because that's the thing is I've had so many families that come in to see me. Their first kid has 8 cavities because they came in off the street. They're sad. I go over my prevention plan, and then 4 years later, the second 2 kids have absolutely 0 cavities. A lot of them even brag they're not even flossing. So it sounds almost too good to be true, but it's actually it's common sense. It's not common. I have 6-year-olds that know more stuff than I did when I finished dental school.
So what carbs are they eating? And what are you switching? I mean, so carbs is a very broad term. What carbs are they typically eating, and what are you switching to?
Okay, now this is Dentistry Uncensored, right, Howard?
Yes.
Okay, can I have a little fun?
Yes, please.
Okay, so let's pretend to do a game show, because I love sarcasm. It gets me in trouble sometimes with patients. So hopefully it doesn't get me in trouble with you, because I really, you're awesome. So we'll do a game show, just kind of play along. All right, so the game show is, are you a holistic dentist or a common sense dentist? Okay, so our first question is, if you have a patient that's drinking soda 8 times a day, and you tell that patient to not drink soda 8 times a day, are you a holistic dentist or a common sense dentist? What would you say?
Well, I'd say both. I mean, I'd say common sense, because holistic is a bad word to a lot of dentists.
Exactly. That's my point, right? It's common sense to cut out don't drink soda 8 times a day. So let's take it one step further. You have a patient comes in and they're eating dried fruit 8 times a day, and you tell them, hey, guess what? Don't eat dried fruit 8 times a day. Are you holistic, or is that common sense? Again, it's both, right? Common sense. Don't eat dried fruit 8 times a day. Now, what if there was a snack food that was the most common snack food in America, and it was 9 times sticky as a piece of white bread, and your patient was eating that 4 times a day, and you said, you know what? You probably shouldn't eat this food that's 9 times stickier than bread 4 times a day. Is that holistic, or is that common sense? I would call that common sense. And guess what? They've done studies, and dried flour, like a cracker or pretzel, is 9 times stickier than a piece of white bread. Yet nobody taught me that in dental school. Like, there's a study from 1991, but the reason we didn't talk about it was because when I was in dental school, it was the low carb diet craze, right? We thought that carbs were super, super healthy and fat was super, super bad. So if we would have said, hey, cut back on flour, you would have said, oh my goodness, it's going to be bad for your heart. Now we know that not all fat's bad for you, especially the natural fats like from a farm. Like eggs are back in fashion, cheese is back, whole milk's back, coconut, fish, and I even think grass-fed, steak and meats are good too. But that's a whole nother conversation. But things that don't spike your insulins from a farm is not as bad. But anyway, my point is, so you just tell a parent, hey, eat a piece of bread instead of a goldfish or a bunny cracker, and it's because it's 9 times stickier. It almost sounds too simple. But again, when you talk to the dentist, go, oh my goodness, that's too simple. There's all this bacteria. But again, I've had so much success. It's crazy going from 8 cavities to 0 cavities. And again, it's common sense. It's not common. Why on earth would you eat something super sticky 8 times a day? And that's my point is, it's simpler than you think. Now, of course, I know you're thinking, oh my gosh, I've got kids that come in and they've got bottles of soda. That nobody's going to listen to that. And we can only help the people that want to help. but that's I look at the best in a person. A lot of dentists get pessimistic because they try to help, and then parents get mad at them. So part of it is the art of saying it in a way that's friendly and they'll still like you, and also realize you can't help everyone. If they come in with a bottle, filled with soda, you're just going to try to get rid of that. You may not be able to cut out the other stuff. But those simple messages, again, you just say, hey, have a piece of toast, have an egg, just have anything else. And in fact, again, it goes to the frequency being the most important thing. And again, every dental a student knows the Vipholm studies from the classic one from the 1950s, where they randomized controlled trial on humans where frequency and stickiness were the most important. And in fact, even in that study, they had the patients who were eating chocolate had a few less cavities because because it's a little higher in fat. We can of course talk about that too. Anyway, so that's the answer. Just eating fresh fruit's better for your teeth than dried fruit. Fresh bread's better for your teeth than dried bread. And that's the analogy. If you just tell that to patients, you don't have to be judgmental. You just kind of educational. And if any parent wants to listen, they can. If they go, oh, I can't cut it out, that's fine. But at least they know. And knowing's half the battle, right? G.I. Joe. So.
We just had an election, and Mayor Bloomberg years back tried to pass a soda consumption limit size and a tax, and he got a lot of flack for that. But he doubled down on it. And he went to the state right below you, California, and he got a sugar tax passed in 3 states. Do you think that's part of the solution? In simple economics, if something's cheaper, you'll sell more. If you raise the price, you'll sell less. Do you think that's a strategy? I mean, do you think soda is a big part of the early childhood caries epidemic that we seem to be seeing?
That's a loaded question. That goes back to psychology and behavior. There's 2 demographics of parents. There's the ones that are trying to be healthy and the ones that aren't trying. And I would categorize any parent that's giving their kids soda below 3 isn't trying. And so it's a whole different mindset. I think a lot of things we do for public health are for the parents that aren't really trying and have no health education. And those admittedly are the most difficult, and we as dentists, we see all of those, but sometimes we lump all the parents that aren't trying into the parents that are trying, right? Because most parents I know aren't giving their kids soda, but that's the thing is if we put it in percentiles, the bottom 20%, they have the worst caries because of poor health education or poor dental education. Those ones are still doing soda, but that's basic parenting skills. Like if you don't know soda is bad for your kid, you're living under a rock. But there's a lot of parents that are in the middle. A lot of parents will do anything you say. Well, not a lot, but there's a small percentage. But then there's the ones in the middle that go, okay, that's kind of cool, but I don't want to make my life harder. It's kind of like flossing. We tell everybody to floss, but only half of adults do it. Like, floss, yeah, maybe. So I guess that's the thing is I want to help every parent that walks in and has an ounce of care for their kids' teeth, and I want to make it as easy as possible for them. And the easiest thing they can do, hands down, even more than fluoride helps 30%, but you want to cut out cavities by 80%. Don't have sticky starches all day, right? You can't out floss a bad diet. Let's say you drank soda all day. Doesn't matter if you floss or not and do fluoride, you're going to get cavities. You'll get maybe 20 or 30% less with fluoride, but it's not going to cut them out completely. You got to stop that habit first, and then you can go from 8 to 0. Because I just always thought that all the research studies, they always talk about going 30% less because we're looking for a correlation. The root cause, though, is the bacteria producing acid. And the bacteria cannot produce acid unless they're touching carbohydrates. And again, glycogen, right? That's how they store carbohydrates. Glycogen does not increase the acid attack by more than a minute or 2. So another thing, though, is when I graduated dental school, we kind of taught that the buffering capacity of saliva was the most important thing, right? But if you look at the mathematical
That's my pediatric baby. She does not like cute. It. She does not like it when I'm talking to a computer and not looking
All
at
right.
it.
Okay.
That is Zelda, my 3rd cat. How many cats do I have to have before I'm a single man right now with 3 cats? How many cats until you say, yeah, that guy's batshit crazy?
I think about 9. So,
Nine. All right. All
yeah,
right. So
sorry for the podcast listeners. There's just a cat that went on my screen. I was wondering if Howard was playing a prank on me. But but my point is, if you look at the mathematics, there's a Swedish research group that looked at this. Elay, and it's actually the saliva rinsing away the acid that makes more sense instead of the buffering capacity. So as long as you have some function in saliva, you're going to pass that acid away. Of course, as a pediatric dentist, I don't work with the geriatric population. For all the general dentists, you're working with the geriatric population where you have xerostomia for medication. That's a whole nother concept. That's why they get caries so quickly. And that's, I don't deal with that, but that's a whole nother, yeah, you have no saliva, it doesn't work. And also at nighttime, you have no saliva either.
I found what you said very profound, where you said that, like a soda tax is something that you're trying to do as a public health service for the people that aren't even trying. I got the Arizona Award from the Arizona State Dental Association for helping to lead water fluoridation in Phoenix. And then 20 years later, it expired, and we had to do it again. And my God, the pushback! It reminded me of this last election. I mean, I would go to those water fluoridation. I debated an anti-fluoridationist. I mean, man, that room, there was people in there where my boys told me, "Dad, quit doing this. You're going to get shot someday." I mean, they were serious, and I did get a death threat. I mean, I literally got a death threat. But my question to you is, same public health question: are you pro water fluoridation or are you against it?
So,
I preface that in saying what you said was profound. I mean, middle class people are drinking bottled water. They're not drinking out of the garden hose like I did when I grew up. And it seems like a lot of the people that aren't trying, they're drinking out of the hose.
Yeah, exactly. Well, I have changed my stance over the years. And again, I'd still, so I don't want to get it. Well, let me preface it with, in Seattle, have you ever watched Portlandia, the show? Like, we got a lot of crazy granola people, and I've slowly turned that way. But I have probably 100 families in my practice that don't do fluoride, but they cut out flour. They're making, if they have dried fruit, they dry it themselves. They eat it 3 times a week. They're never eating crackers. They're never eating juice. They're cavity free. So that's the thing is, now only about 1% of the population can do that, right? Not even I can't be as perfect as them. I still use fluoride for my kids. I use fluoride toothpaste. I do fluoride every 6 months. I recommend it for all my patients. But in Seattle, you get in trouble really quickly if someone says, I don't want it, and you try to push it. So I don't push it. But what I do, instead of just getting confrontational and getting in a fight like I used to when I graduated from dental school, the reason we get so emotional, Howard, is because we care. Right. And it's the disconnect. That parent, you feel like they don't care about their kid's teeth, and you do. And that's why you get angry. But what I found is those parents do care. They just make a random decision because they want something out of their body. And I respect that decision. And if they still care about teeth, I can help them, and they can still stay cavity free. They have to work 30% harder than everyone else. They have to do more than I do. And there is 1 or 2% of the population that can do that. But that's the thing is, if you get that person, you think they're crazy, and they're just the ones that maybe are healthier than you. So going back to a second, my personal view on fluoridated water, it's for that 30% that's not compliant. They're not going to the dentist. They're having trouble. They're giving their kids soda. They're doing all the bad things. That's what I believe it's for. It's not for my Seattle parents that are doing all this stuff. So, and I've totally changed my view over the years on that, because when you don't know that dried flour causes cavities, the only thing you think that this 3-year-old got cavities, it must be because they didn't drink fluoridated water. And because what else can you blame? Or it must be genetics. So why is this 3-year-old getting cavities? Then you go, because they were eating goldfish crackers all day. It's such, I can't believe my first 4 years of practice I didn't know this. Now, I'm not the first dentist to realize that crackers cause cavities. There's many older dentists that have figured this out and been telling their patients successfully. But my point is, if we're looking at it from a public health policy, if we're doing a campaign, we're spending millions of dollars. If we tell people to brush 2 minutes twice a day, 1, they're not going to do it. 2, if they don't change their diet, it's not going to help. If we do a public health policy for the ADA, their AAPD, we need to focus on frequency and stickiness. And we should just do a campaign that says, hey, eat bread instead of crackers. Again, we're not saying it's not bad. It's not bad for you. Just like dried fruit is healthy for you. A cracker's just as healthy as bread. But that's the thing. If we're doing a national campaign, if you just tell your patients one thing, you just tell them, hey, eat fresh stuff instead of the sticky stuff. They'll listen or they won't, but at least you know. But going back to your answer, my personal belief is I wouldn't take fluoride out of the water unless we put warning labels on every juice bottle and every cracker box. It says, caution, these will cause cavities very quickly. Once we do that, then I'm okay with taking fluoride out of the water, because I want it there to help that 30 to 40% of the population, because they have the worst cavities. They're the ones that are filling up the emergency rooms. It's not for the parents, like you said, they're drinking bottled water and are eating whole foods. And that's the thing is, you have a parent that comes in and you think they're crazy because they're anti-fluoride and they're organic and they're still getting cavities. Again, if they're not aware of the flour, the frequency thing. And I still have families that come in, are paleo, and they're eating oranges and bananas all day, or constant fruit all day, or constant milk all day. And this, it's frequency still trumps that. And the acidity of oranges are important, and the stickiness of bananas. You want that variety of fruits and vegetables. So I still vote for fluoride in the water until we put warning labels on crackers and juice. That's my stance.
It's just so sad because I'm in Phoenix. I mean, I'm not in Scottsdale or Paradise Valley. 25% of my 5-mile radius is the Guadalupe Indian Reservation, and they all speak Spanish as their primary language, if not their only language. And it's just so sad when a mom tells you that she uses soda, because if she buys a gallon of milk, it always goes bad in 3 days, but the soda never goes bad.
Oh, that's sad. Yeah.
And you're just like, so I want to stay on public health with you. There's so much, these naturalists, these holistic people that are coming to your practice. Are you seeing any pushback from BPA and composites? Do they ever not want the white toxic fillings?
It's very rare in my area. I know there are other areas. I'm more in the kind of up middle blue collar area. But that's the thing is I have quite a few naturopathic doctors that come see me, and they're perfectly normal. And one even told me, they go, look, I've looked at it, and she realizes the risk reward, right? She goes, the super small amount of BPA that leaches from a non-BPA, a BPA-free sealant is so much less than if they were to get a cavity and get a filling. She says, okay, I'll do a sealant, because the risk versus reward. And then again, you tell them, okay, well, we can do a composite. I could do a glass ionomer. I just tell them, if we do a glass ionomer, it wears down faster. It rubs away, it just doesn't last as long. But we have that as an option. But I haven't even done a glass ionomer filling, because usually I just talk to them. I go, this is what every dentist, in the dental school uses. So I don't get much pushback, but I can see how other areas of my state would. So that's, but yeah, you go the risk reward, and some people are just illogical. They don't look at the risk reward. And again, a lot of it is the disconnect between, they just don't care about teeth and we do, and we get mad. So part of it goes, you can't help someone that doesn't care about teeth, whether they're the person giving their kid soda, that makes us mad, and the person who's doing other healthy things, but it still makes us mad. So as dentists, we're just second-class citizens sometimes, because we deal with teeth, and not everyone dreams about teeth like we do.
I want to stay on sealants, because it's actually even quite controversial in the research and on Dental Town. I mean, you can find 100 studies that say half the sealants fail within a year and the other half fail at the end of 2 years. What is your view on sealants?
Sealants are great. And again, I tell parents, if you're a normal American family, sealant's going to benefit you, because if you eat flour and sugar, you should have them. And I'm going to do sealants on my kid as soon as their adult molars come in. If I've even done some on their primary molars, because they had a little hypoplasia. But that's the thing is, if you're I acknowledge that 1%. I kind of joke, yeah, just go paleo. You don't need sealants. And they kind of laugh at me and go, okay, sign me up for sealants. I'm not doing that. For retention, I think number one thing is training. And I use an iSlide every time I do a sealant, because if I feel like I do cotton roll isolation, you get a little saliva on and it falls off, it's not worth it. So I either go isolite or bust. If I can't get an iSlide in because they're gaggy, because there's 5% of the population that's just too gaggy. But I feel like, why use cotton roll isolation, get saliva on there, and have it fall off? Yeah, I don't think it's worthwhile if you do that. So I do an iSlide every time. I have my assistants do that. Again, training super well. You got to pumice. You got to make sure that the etch, all the basics, the etch stays on for 15 seconds. Make sure it's completely rinsed off and there's no contamination. The Isolite, there's other companies too, other than Isolite too, but having really good isolation.
What brand of sealant do you use?
I use the Ultradent. Is it XT Plus? Yeah, the flowable composite.
Okay, what do you say to a kid who's looking at the research and says, well, if you would have just done a preventative resin restoration and prepped it out for an occlusal composite, that would have been better than a sealant? And then some people are saying, yeah, but you just did extension for prevention. Well, how do you weigh in your mind between doing a preventative resin restoration, which is basically a prepped occlusal composite, versus a sealant?
So there's already some caries there, or are you talking about a little start of a cavity? I guess I'm confused on the question.
Well, so let's say no. I mean, if you look at the DMFT studies of 65-year-old Americans, I mean, the first molars and second molars, it's like 99% are all going to be disease missing. So this tooth, that environment, it's going to end up being a house here. So some people think, well, then you should kind of like let's do this analogy. You have a birdhouse. You're mad because every day you walk out to your new car and there's bird crap on it. So you fill up the birdhouse with cement. No bird's going to live there. So if these pits and fissures are all going to decay by age 65, there's one theory that you could just prep out the pit and fissure and then place a composite, and that will last longer than a dental sealant. How does that?
I see your logic there. Okay. Two factors. Yeah, you have a tooth that doesn't have a cavity, but you're saying, well, should we just clean out the pits and fissures because it's going to have better retention and it's going to last longer? I think if that's your argument, I think your technique for sealants is incorrect. Like you either have isolation issues, you're not pumicing off the salivary pellicle, or you're not, you're doing the basics. You're not leaving on the acid etch for the full 15 seconds. You're not completely rinsing the acid etch off. If there's a little acid left, those are or you're getting contaminated with saliva. Those are the biggest causes for failure for sealants. Of course, if you want to use Bond or something like Primadry, the studies show that the retention goes up if you use that. But I would argue if you're having that much trouble with sealants, you're not having good isolation technique. And also, two, if you're getting recurrent decay, now I tell patients, I go, this sealant is great. It doesn't prevent cavities from liquid sugars. It just, if you drank soda, again, as the classic example, or juice, you'll just get a cavity around it, right? So that's the thing. It depends which population you're working with, but that doesn't mean, I don't think that means you go in and you prep it right away. You just have to get them to stop drinking the soda, right? It doesn't matter.
What do you say we take the fluoride out of the water and put it into the soda and just fluoridate the soda? I want to ask you another question that every one of my homies is hearing this. I just read in the newspaper that you don't even have to floss, that there's no research. It doesn't even do anything. I read it in the newspaper. What do you say to those parents?
You know what I say to them? I go, I'm the 1 out of 1,000 dentists who actually agrees with that, but let me tell you why before you get upset. Because that's the thing is, we as dentists, we want to do everything to help our patients, and I do too. So, and if you, and again, going back to, so what does flossing do first, right? Flossing, we think, helps get rid of the bacteria, the biofilm in between the interproximal area. But how thick is that biofilm? It's probably 1/4 of a millimeter, right? If you look at the mathematical model, the thickness of the biofilm does affect how much acid is made. But guess what? If you give your kid a peanut or an almond instead of a goldfish cracker, how much acid is made? 0 versus 20 to 30 minutes.
Okay, I got to take a break right now. Ryan, can you go throw away my goldfish? I got that big quart box from Costco. I think Roger's telling me I'm supposed to throw that away.
Oh, good. I'm glad I convinced you.
We'll start the show back. Okay, go on.
Okay, so now what happens? So we think, okay, if we get everybody to floss, we're going to get rid of that bacteria. But guess what? You're never going to get rid of all the bacteria. Right. And again, going back to the chocolate milk or the soda example, you floss at night, you get rid of the you break it down from 1/4 of a millimeter to 1/10 of a millimeter. And then the next morning, again, you can't outfloss a bad tooth diet. If you ate fruit every 30 minutes and you flossed, it wouldn't matter. The few times, and that's the thing is, we as dentists, we look at the interproximal, we go, flossing must work, because that's where it is. It makes sense, right? It makes sense. But again, the only randomized controlled study that actually showed flossing helped was when dentists did it professionally at school. Okay, why? But when they did it at home, it didn't work. And we just go, oh, must be bad testing. It must be bad testing. But my hypothesis actually explains that better. Because my hypothesis is flossing helps to get rid of the carbohydrates that are stuck between the teeth. So that's why dentists professionally doing it at school would help, because they eat the cracker at school and they floss it out. It's not going to be stuck as long. But at home, it doesn't work for two reasons. One, if you've got starches stuck between your teeth all day and you floss at night, it's maybe going to help by 20 or 30%, but it's not going to help by 80%. And two, most people suck at flossing, right? So even if we tell everybody in the world, you got to floss, you got to floss, you got to floss, even I think the last study I looked at, only half of adults floss. So if only half of adults floss, less of that percentage is actually going to floss their kids' teeth. So flossing is your only option to prevent cavities based on just motivation and human behavior. We're never going to get more than 50% of the population to prevent all the cavities. But if I can present to you an alternative way, I'd say, hey, guess what? You want to know the secret to have zero cavities and get away with not flossing? Eat foods in this category, not this category. Because guess what? You eat an apple and cheese, there's nothing stuck between your teeth. You don't have to brush after that. You don't have to floss after that. So my hypothesis actually explains it better. And I kind of use an analogy. You know Spock from Star Trek?
Yes.
Right. Vulcan versus Kirk. So Spock is pure logic, no emotion. He just looks at the data and he makes a decision. And then Kirk is all emotion. He does how he feels. We as dentists, we talk like we're Spock, but we act like Kirk, right? We say, you know what? We need randomized controlled studies. We need to look at the meta-analysis. We need to look at the evidence, and we got to follow that. Oh, but it doesn't agree with what we think because I feel like flossing is awesome for preventing cavities, and you just don't understand. I want to help so much, and so if I don't get them to floss, everybody's going to get so many cavities because it's in between the teeth. It's in between the teeth. We focus on that. But if you're Spock, you look at the randomized control data. Guess what? Over and over again, flossing doesn't help. Now, it doesn't matter the reason, right? Maybe if people were perfect at it, they would work, but only by 20 to 30% based on the math. But that's the thing is the frequency and the stickiness of carbohydrates over and over in vitro and in person is 80, 90% more important than whether you floss or not. Now, having said that.
Back to Kirk and Spock, though, which one gets the hot check? Logic or emotion?
Definitely. Oh, it's always Kirk. It's always Kirk. Fun.
Okay, so there's your answer.
Now, I still floss my kids' teeth. I floss every night, and I recommend to floss, but I kind of joke I go, hey, guess what? You want to know the secret? This is how you get away with not doing it. Because think about you're a parent and you have a 2-year-old with tight contacts. The genetic variable is when your contacts start to touch. When do A and B and I and J and K and L and S and T? If they start to touch at 2, you're kind of screwed. Right? If they touch at 4, you get away with not flossing because there's nothing getting stuck. So if I see a parent and their kids' teeth are touching at 2, I go, guess what? You have bad genetics. It's going to be really, really easy for you to get cavities. There is a way. You're going to think I'm crazy, but eat bread instead of crackers. I know it's crazy, but if you want to get away with not flossing, do that. In fact, have ice cream every night if you want. Just don't eat goldfish crackers all day because sugar in the ice cream rinses away. Again, you can see why parents like me, right? I tell them to eat dark chocolate and ice cream, and I joke with them like you can make fun of me that I talk about crackers all the time. My friends make fun of me. They bring crackers over to the poker game, and and also, I look at it the other way. If you're a Spock and you're a scientist and you have a patient that comes in, they never floss, and they have perfect teeth and no cavities, you go, you put it into your paradigm. You go, it must be genetics. You must be lucky. And in fact, you're kind of mad at them, like, how did you get away with that? But that's the thing. If you eat a bad diet, but it's not sticky, you eat pizza, you eat cheeseburgers, you chug down soda very quickly like you're a teenager, and you never floss, there's nothing stuck between the teeth. You can get away with it. It's the teenage girl that has meticulous oral hygiene. She's taking great care of her teeth, but she's nibbling on pretzels, at school, and she's having her organic juice, her iced tea with a little sugar all day, and she's flossing and she's still getting cavities. So it's not this it's not this crazy genetic thing. It's just a matter of mathematics.
And what's ironic is cracker in Spanish means dentist, because when I go over into Guadalupe, they always call me cracker. I must be Spanish. Hey, I want to ask you a restorative dentistry question. You just said, what are the molars? A and B. What are the A and B? Which one? You just rattled through them.
I and J, K and L, and S and T. That's where you get all the interproximal
A and
MOD.
B, I and J.
K and L, S and T.
KNL S&T. I want to ask you a restorative question because
Yeah.
an old man pediatric dentist tipped me off to this in '87. He says, "Look, he says if you have enough going on in between the first and second primary baby milk teeth, deciduous molars, to have a cavity, an MO on A, he goes, damn it, there's one on B. And if you don't see it and it's not on the radiograph, you don't have an open bite wing, because if you do an MO on B, by the time that kid comes back to your office, if you did an MO on A, B will probably end up needing a pulpotomy and a chromosome crown." And he said, "I'm telling you, they're always in pairs. If you got an MO on A, there is a DO on B." What would you say to that?
I would say 80% of the time that's true.
Okay,
And you know, it's the classic example when a lot of times you can't get your first bite wings till age 4.5 or 5 because they just can't handle it. And how many parents are surprised when you get I tell parents you usually get 8 or you get 0. Now, so that's especially from the general population, that's true. But usually you can see them. And if I see a DO on B and it's past the enamel, and I see an incipient lesion that's not past the enamel on A, I definitely fix that. But I tell the parent, I go, listen, I wouldn't fix this one if it was by itself. We'd floss and do fluoride rinse. But since I'm in there, we should fix it. So if I see incipient lesion, heck yes. Now, if I see no incipient lesion, I may say, let's check A. Now, let's go back a step. If you don't know dried flour causes cavities, of course, everything's going to turn to a pulpecid because every kid in America eats it all day. So yeah, of course, you don't fix it and it comes back to the cavity 6 months later because you haven't solved the problem. You haven't educated the parent. That's, again, the number. Just handing out a snack guide, even if you don't have to do it. You just hand out a sheet of paper. You can use my snack guide. I got my website. There's a UW snack guide. You can hand out a sheet of paper that says
snack guide. Can I push it out on social media? You got it in a JPEG?
Oh yeah, we do. Yeah, it's thedentistdad.com/snack guide.
And can I push that out on social?
Oh yeah, please do. That's the thing is you don't have to spend 5 or 10 minutes talking prevention if you're a general dentist because you don't have time. I get that. You can just hand it out and say, here you go. Here you go. And we can, I'm even making a new one to make your practice, you can put your practice name on it, or you can have your graphics guy put your name on it. I have a little area because you want to market your own practice.
I don't want my name on it. Last thing I want is a bunch of damn kids coming to my office. I'm going to put your name on it. They say, hey, he's in Seattle. I'll say, I'll pay your airfare to go visit this guy.
Yeah, this crazy guy who's a holistic dentist because he says don't eat crackers. Yeah, so anyway, yeah, you can get that. It does have my name on it too, but yeah, I can make it. I've had some dentists call me and they changed it, they adapted. Just call me, I can work with you. They're giving it to the pediatricians. So anyway, so yeah, if you don't know dried flour can cause cavities, everything's going to turn to cavity, every incipient lesion, and you get frustrated and you fix it and it comes back. I have so little recurrent decay now. It's crazy. In fact, I get but I have less sedations, less crying moms. I wouldn't trade it for the world. It's so wonderful.
I'm telling you guys, if you got to go to thedentistdad.com. I'm looking at his 2-snack guide. Won't cause cavities. Low carb foods usually won't cause cavities, and then causes cavities easily. This is great stuff that you should be putting on your dental office Facebook page. But by the way, where did the name come from? The Dentist Dad. Where did you come up with that?
Well, I've got 3 daughters, and
I'm sorry.
Yeah,
I'm so sorry.
It's fine now. Heard it's worse later.
Do you have a fund opened at a bank that I can donate to for your? I grew up with 5 sisters, so it's all going to seem just perfect until they turn about 16.
Yeah. So, yeah. So I just thought it would be kind of catchy. Dentistdad.com was taken, so make sure you put the in front of it. Thedentistdad.com. Going back to your going back to your question for the AMOBDO. So what I'll do, I'll sometimes make a note to check. I may treatment plan an MO and A, and I'll make a note to check, and I'll have the parent plan on too, because you don't want them upset. And if I go in there and there's no incipient lesion, I won't fix it. Now, if I'm doing a general anesthesia case, if they're very high risk, if this patient doesn't have a dental home, they're not going to ever come see me again, you can make the argument to do a smaller incipient lesion on A. But if you know they come back and see every 6 months, you can change that. And it depends on the caries risk, right?
And if you're doing a filling on a pediatric baby deciduous tooth, if it's deep, do you ever use silver diamine fluoride?
Yeah, we just started using that about a year ago. I think a month after it got FDA approved. Now I've been preventing cavities and stopping them with this snack guide for years. Not everybody can do it, and I tell parents that I have a family come in. and it's let's say ENF or bombed out because they went to bed with milk, but it's a motivated parent. If you have a motivated parent, it's possible. It's just really hard. And I say, guess what? You can do general anesthesia and you can fix these, or we can wait and we may have to extract them. Now, as long as you're not mad at me that we may have to extract these because I can't predict the future, you can avoid general anesthesia, but you have to do this, this, and this. You have to not drink juice all day. You have to drink water and whole milk at meals. You have to have organized snack time. Don't eat oranges all day. Have fresh bread instead of crackers. The only sweet you can have is ice cream or dark chocolate. Don't have anything else. I had one family switch from goldfish crackers to just nuts as a snack. You do have to be careful with nuts because they're a choking hazard for 3 and under. But they were able to stop the decay and arrest the decay and successfully not have to do surgery, and it just stopped in its tracks for 3 or 4 years. And that was before silver diamine fluoride. Silver diamine fluoride is the next level because it helps kill that bacteria directly. So, and again, silver diamine fluoride is a little bit better for the non-compliant patient, and it gives you a little extra boost. So I'm definitely using that because I know nobody's perfect with compliance. Even I'm not. The one problem with the anteriors is it looks horrible. So you have to have informed consent. I think I use the University of San Francisco's like a modified informed consent form from them because you don't want to, and you also informed consent. It doesn't guarantee it grows. It just is it's an extra boost, a little more than regular fluoride. But yeah, especially for those ones you can't see in the back, that's, you get a little start of occlusal. Sometimes I'll even put that on a little pre-cavity on a 3-year-old. I just tell them, hey, this tastes horrible, but hopefully if they keep still, we can keep it off. Just put that little drop. Yeah, maybe.
Where
maybe
are you buying the silver diamine fluoride from? What brand are you using?
There's only one brand available because it just got FDA approved. In fact, the guy, Dr. Peter Milgram's is a UW professor. He's the one that helped get it FDA approved. So he's been talking about it for years up here. But it's only Advantage Arrest. And I have no connection to the company except
Advantage Arrest?
Yeah, I know Dr. Milgram, but yeah, the pediatric dentists all on the forums were talking there. It's the next latest, greatest thing. But my point is, silver diamine fluoride is great, but you also have to get those dietary changes. You do both, even better. Even if you have a non-compliant patient, I would put that on. It's not going to solve everything, but it is an extra tool, and I'm definitely using that. Just that little drop. So.
And what are you saying to mom when she says, "I don't want that silver chrome steel crown. It's got to be tooth colored"? Are you doing any tooth colored chrome steel crowns?
I want to. Like 4 years ago, I took a course. I won't mention the brand name, and
was it out of Houston?
No. So it was not out of Houston. It's not
one
of
where they were out of.
It's not one of the Utah.
Okay.
So yeah, I flew to Utah, and then and I tried them, and they all broke. Now, it's not one of the most popular ones. It's not the top 3. So, and what happened, and it was not fun. So I'm waiting for my friends, my other pediatric dental friends, to try them and get better results. So far, the ones I've talked to, it's not as great. Like, it's kind of good. So what I tell parents, this is the phrase I use, and most parents in my practice don't ask. I say, listen, the reason we do this crown because it needs a crown, whatever reason it is. The reason we don't do porcelain crowns is because they cost $1,200 each. So we don't want to spend that much money on a baby tooth you lose when you're 10. And the parents go, yeah, that makes sense. And also the other reason we don't do the porcelain crowns is because kids grind their teeth and they chip through. It's going to break in about a week. And what's the most common question from parents you get? Why does my kid grind their teeth? Is that okay? Every parent knows their kids grind their teeth. And then usually they say that now I know there's other communities where that's not as acceptable. So if you live in a community where it's not, you may just kind of be forced to try those. And from what I've heard is the success rate is good, but it's not great. And maybe it's, not in my hands or that thing. So I'm waiting for all my friends to say, this is the one to go to. And I'll hopefully if I hear that, I'll switch to that. But in my particular community, once I explain it to parents, most parents say, oh, that makes sense. And guess what? The US Weekly, I think last week, you can look at Suri Cruz, Tom Cruise's daughter, and Katie Holmes' daughter. You look really closely. There's a little SSC on B that she has. So if you can pull, I don't have a link to that. I got to find that. But you can say, hey, even Suri Cruz had a stainless steel crown. She did fine. So, yeah, if that answers your question.
What about when parents are asking you, should I switch my kids to xylitol gum?
Oh, well, if you're doing gum in the first place, of course, switch to xylitol gum. I choose xylitol gum every day. The best time to do it is obviously after a meal. So what I say, if you're going to do xylitol gum, or if you're going to do any sugar-free gum, do it after a meal, because that's what helps prevent the cavities, because it gets your saliva flowing. And there have been a few studies that show sugar-free gums can help reduce cavities. And
What
then
type of xylitol gum do you like?
I like them all, but Epic, Spry,
Epic?
yeah, Epic and Spry are the
Now I want to ask you the most controversial question in all of pediatric dentistry. Do you let mom and dad come back in the room or not?
Well, that's funny. I just gave an hour lecture to explain how what I do to make my life not stressed out and manage the parent. It's a whole lecture on managing the parent. Maybe I can do that one for a CE course. But my basic question is, you need to, let's see, I definitely let them back. I let them back. But what I do is I use a few different psychology principles to convince them to be a silent observer and let the movie distract them and let us distract them for them. Now, but one of my principles is that you can't tell a parent what to do. You have to convince a parent what to do. If you tell a parent, please be a silent observer, I mean, the coroner, most aren't going to listen to you, and they're still going to be going, are you okay? Does it hurt? So you have to convince a parent it's a good idea. Let me give you one example. The little phrase I use is, so studies show that kids do better with distraction and humor from parents instead of the normal parent things, such as, are you okay? Does it hurt? How's it going? And I kind of mimic that. And so you're welcome back to come back. All we ask is that you be a silent observer and let the movie distract them for us, or we'll distract them at the right time. And when I tell them there's a study that shows that, and also you kind of realize how silly it is to say, are you okay? Does it hurt? The parents know, okay, I guess I don't have to help out. This dentist is confident. There's more. I mean, you got to kind of do a setup beforehand. Like I said, it takes a whole hour to talk about. But and the study that I referenced, for those that are curious, is a 2007 Journal of Pediatrics. It's actually on vaccines, but I don't tell my patients that. But they showed distraction and humor. The kids felt less pain instead of comforting and saying, I'm sorry. But that's the thing, is if you don't tell parents what to do, they're going to want to help, right? Any parent's going to want to help. So you don't give them clear guidelines that say, hey, I've got this. It's okay. But yeah, that's a whole nother lecture.
I know this is off topic, but you just opened a can of worms in vaccines, and I always have, lots of parents still ask you about vaccines and autism. It comes up. It's even some of my dentist friends have not even vaccinated their kids, and it's on the news again today. What the autism rate? I mean, you're a pediatric dentist. A lot of people are reporting that autism rate is really going up, and what do you think of autism? Why is autism going up? And do you think it has any link to vaccinations?
No, there's no evidence whatsoever it's linked to vaccines. And if a parent doesn't want to do fluoride, if a parent doesn't want to do sealant, I don't get that mad. But yeah, if a parent doesn't do vaccine, that kills kids, because my local pediatrician office, that's where a baby died because they got whooping cough, for something that's got a vaccine. Yeah, that is, I do get mad at that. And yeah, I don't care if my friends dislike me for being pro-vaccine. Now, doing it in a different schedule, sure, whatever. But just no vaccines whatsoever is just is short-sighted. It's like saying,
in your 10 years as a pediatric dentist, are you seeing an increase in autistic children?
I don't know if it's an increase or just because as a specialist and we see a lot of autistic kids, they get referred to me more. Yeah, and as you know, anything we say that is the cause of it is, in my mind, speculation. There's an argument that more really smart engineering type minds are breeding together because you got the software companies and you have two engineers, that kind of genetics. I guess
one of the co-founders of Google is autistic, Larry Page.
Yeah, well, I mean, Bill Gates, he has had what was used to be called Asperger's. It's obvious.
Bill Gates does?
Well, no, nobody said that, but that's my diagnosis.
Yeah.
But, I waited tables in Seattle, and I actually served him water once when I was 18. And you saw he was sitting on his chair just rocking back and forth, but that's the thing is you can be high functioning autism, you can rule the world, right? So it's not a bad thing. It's just you have to learn social cues a little bit better. I kind of joke that I have really, really mild ASD. I have to learn these social cues. I don't so I can read people's faces and kind of try to think about what they're feeling. But yeah.
Now I want to ask you the most stressful question in all of pediatric dentists. the divorced parents fighting over the bill. How do you handle, because you know the kid is a some kind of weird power play weird thing, especially when like one's an attorney and one's an engineer at Intel and you're like, you could both pay for this. How do you deal with the crazy divorced parents with the 3-year-old caught in the middle?
Oh man. Well, yeah, that is really stressful for me. And even yeah, my parents divorced when I was 5, so it's another emotional hotspot. But if you can tell that before, what we usually do is we ask for the page of the parenting plan that says who's in charge, and we try to set up. We say we don't care about who pays. Like sometimes we may ask them to pay up front, so there's no argument, because parents are going to try to protect their kid. So the mom will come in, she'll get it fixed, and then she'll go home and say, "Oh, guess what? I'm not responsible," and now you're stuck. If you already get to that situation, you're in a tough spot. I mean, honestly, yeah, I don't have really good advice other than trying to ask for it up front if you know it beforehand. If it happens after the fact, you know what, I got to be honest, yeah, dentistry, there's that 0.5%, and it's not the kid's fault. You may come up with some compromise, I guess, but that is just I don't have a good answer.
Now I want to talk about another controversy. This is Dentistry Uncensored. A lot of orthodontists do not like when pediatric dentists do early intervention. They say it maxes out the children's lifetime benefits. Say it's a stable employer, like say where you're in the neck of the woods, like Boeing, and they say the pediatric dentist used all the benefits for the lifetime ortho by doing a rapid palatal expander. What do you do early stage orthodontics?
I don't, but it's not out of an ethical or moral reason. It's just because just efficiency, So it's not So I think that's always that's just probably more of a what do you call it? Just more of a territory thing. Of course they want to do it more. Why would they have them do it when they could do it? And I have to admit, when I first graduated, I was more, it depends where you go to school. This is what my analysis, wherever you go to school in the country, whatever they teach you, that's going to be your philosophy. And some schools are more palatal expansion and some are less. So I've gotten more conservative with palatal expansion implants when I recommend them. When I even tell parents, part of it's just telling them, because the science is a little gray area, right? But I usually tell them, like, listen, over 5 millimeters, it's really nice to do the palatal expansion appliance. Less than 5 millimeters, I almost don't even refer anymore. Or I tell them, hey, you have an option if it's bothering you. If you're getting made fun of at school, you can talk to orthodontists about the option of phase 1. But if it's less than 5 millimeters overjets, I usually don't refer. 5 millimeters or more, personally, I just think it looks way better. The science is kind of gray. And I'll tell the parent that. I go, yeah, it's a little, but it's more than 5 millimeters. I mean, you want to get some, change. So I think that's more of a territory issue. If you're being conserved, you're doing it the right time, you have informed consent, and it's benefiting the parent. It's just, and also I guess preparing the parent that they're still going to have to pay for orthodontics later. I have heard from some, this is uncensored, right?
Yes.
I've heard from some orthodontists that the reason they don't like to do phase 1 is because it looks so good. So oftentimes they don't want to do phase 2.
I want to keep with the controversies. There are even dentists on Dental Town that think a papoose board falls under cruel and unusual punishment and thinks it should go away. What are your thoughts on papoose boards? Because I know the counter argument is, if I don't put this kid in a papoose board, I'm gonna have to take him to a hospital and sedate him, and there's more anesthesiology risk putting a kid under than there is hurting his mental health versus oral health. What are your thoughts on papoose boards? Do you use them? How often do you use them?
I have not used a papoose board since residency, so I don't like them myself. However, I don't judge any pediatric dentist that uses them with informed consent and uses them correctly, right? Because there is a time and a need for that. What I don't like is using them without a fully informed consent. And fully informed consent is, hey, maybe we can delay treatment. Now, again, if you're in a community, if you don't know how to prevent cavities because you don't have a guide, then yeah, you can't. Every cavity is going to grow, so you feel like you got to cap them all and get them done right away. But silver diamine fluoride's out now. There's a SNAC guide out. We've got more data on don't eat sticky starches all day. If you're in a community health center, it's a little harder. But at the same time, you should never assume what a parent thinks. You shouldn't assume just because they're low socioeconomic status that they're not going to care for their kid. That would be really not nice of you as a person. But what happens is we get set in our ways and we just start assuming things. I kind of so yeah.
Some things you can assume. In my 29 years, my very poor patients from Guadalupe Indian Reservation have always paid their bill. And
Yeah.
the very rich patients that come in from Scottsdale, Paradise Valley, I mean, a fool in their money always parts. The rich people are the hardest payers on earth. And whenever I talk to a dentist, they always tell you who their most famous patient is, and it'll be some multi-millionaire guy that you've heard of before. And then I'll say, what was it like treating him? And he goes, oh, it took me 6 months to get his bill paid. And I thought, yeah, that's all you hear.
So, yeah, and part of informed consent may be saying, hey, there is an option for general anesthesia. Maybe a parent may want that, or or silver diamond, or delaying treatment. So, yeah, where it's not used correctly is at maybe some of those, those corporate mills where they're just putting every kid in a papoose board. They're not getting informed consent, and that's obviously horrible. And that's where we as a profession look bad. So not all of the corporate dentists are bad corporate. Not every corporation is bad, like you mentioned before. But it's that's where it can get into more trouble, is what I've seen. But even a private practice can get in trouble too if they just do it to every kid.
We've really looked bad a couple of times this year. One was, when a child dies during sedation. We just had a big case in Hawaii. I mean, and I think aren't they pressing criminal charges?
I believe so. There's I am anti triple cocktails. And no, in my opinion, no one should be using chlorohydrate anymore. There's many deaths associated with chlorohydrate. It's just, so they're still used in different parts of the country. And also, the more cocktails you do, the more dangerous it is.
So what are they putting in the triple cocktail? Chlorohydrate?
Well, yeah, that's often it's getting used less and less and less. But yeah, there's no reversal agent for chlorohydrate. So why would you use something that has zero reversal agent? But at the same time, there is a need for that moderate sedation. So and papoose board. So even if I don't offer that, some other pediatric dentists may judge me for saying, why are you're doing more general anesthesia cases? I mean, but part of it's also the part of the country where I'm in. Very few Seattle dentists do that moderate oral sedation with a papoose board. Other parts of the country, they do them, every pediatric dentist does them. So it's kind of the culture you're in too.
Where do they use them a lot? What part of the country?
Well, I don't know. I hate to say it.
Well, the one that was all over the newspaper was down in Florida.
Okay, yeah. I mean, I don't know. The bigger cities, I guess. When I did, East Coast, a few places.
I want to go back to sedation. So, for if you had 100 kids that needed restorative dentistry, or that'd be fillings and pulpotomies, grumps, crowns, what percent do you just use behavioral management? What percent would be nitrous? What percent would literally be sedated? And would you do that in the office, or would you take that child into a hospital?
Yeah, so a lot of that goes down to personal choice. So my way is not the best way. But when I do restorative, 99% of the time for kids 10 and under, I use nitrous oxide, because that's my.
Do you use it on yourself or on
yes,
the patient?
On myself, not the patient. No, yeah. So we use it for the patient.
99% of the time. On what level?
Usually 50-50. Yeah, that's
50-50.
But if it's a really good, but I explain to the parent, I go, hey, a lot of kids don't need it, but it's anti-anxiety, it's anti-pain. And the way I practice, it just makes them more comfortable. A lot of times and maybe I do use it as a crutch. I've got to admit that. But at the same time, my viewpoint, my philosophy is, if you can use a little safe pharmacological agent where the biggest risk is nausea or vomiting, and if you don't eat beforehand, that goes way down, then and make it more comfortable, why not? Now, if I've got a really cooperative kid and the parent says, I don't want nitrous, and I look at them, I go, okay, if you want, they can talk me out of it. It's not like I'm strict. But most parents, when I talk about I talk about the whole process, by the time they hear the process, they go, okay, yeah, let's do that. And older kids, it's just,
I feel so sorry for my dental assistant, Jan. I've had my one dental assistant my whole career, 29 years, Jan. And, I don't know what it is, but, you're over the patient, whether it be a kid or an adult. And when they start to throw up, my right hand shoves that head over, and they splash her every time. I mean, once a year, she's got to go in the break room and change her clothes because she's been completely vomited on us.
So what made me get puked on less, Howard, was we told patients recommended not to eat at least 2 hours before. If you do eat, don't eat any dairy. If you have anything at all, have a piece of toast and some clear liquids. If you want to be on the safe side, don't eat 4 hours before. I think 4 may be the official. So yeah, and a lot of times those young kids, have them skip breakfast, come in, treat them in the morning. We try to see most kids 5 and under in the morning, not in the
It really
afternoon.
does. The puking really doesn't bother me. It just bothers
Oh, that's
Jan.
good. Yeah,
Uh,
that's right.
um, I want, and a lot of times the patients are asking. You're talking to a lot of young dentists on podcasts. The mom says to the dentist, "My baby, she's always grinding her teeth. I mean, she's 5 years old, and when she's taking a nap, sleeping, she's just grinding. It sounds like marbles crunching. What should be done when a 5-year-old is grinding their teeth a lot?"
Oh, although grinding teeth, I tell parents that's a sound issue. It's not a tooth issue, because I rarely see bad outcomes for grinding with severe attrition. I tell parents, I get asked this question multiple times a day because I do, and it's a sound issue. Don't worry about it. Even if they're very severe grinders, you grind the front teeth a lot, but those are the ones that fall out sooner. So I rarely see a problem. The back teeth you grind down, but they don't grind down as quickly. So it usually works itself out. So there's not much you can do. You don't want to put if it's there's maybe one kid a year, I may say, let's do a little sports mouth guard just temporarily, but those you usually can't even tolerate anyway. So I just let the parents know, don't worry about it. It just sounds absolutely horrible, because it does sound horrible when they're hearing it at home. Going back to the last question though, because I don't want, I do 1% of my patients, we do general anesthesia. When we've tried delaying treatment, doesn't work. When they're in pain, when we have no other options, we do about 4 or 5 surgery cases a month in office with an MD anesthesiologist, and that's the common practice in the Seattle area from talking to my colleagues. And I do some other mild oral sedation too. But yeah, I do a lot more delaying treatment than I used to, with informed consent. Just making sure the parents know there is a chance it may not grow. But anyway, I just wanted to tell people I do other sedation other than nitrous. So.
I can't believe we did an hour. We're already in overtime, but I still got one more. Can I ask one overtime question?
Of course.
Everybody always wants to know, a pediatric dentist, what is your fluoride protocol? How do you do your fluoride treatment? Do you do trays? Do you do a rinse? Do you use what's the sticky stuff you put on?
Yeah, the varnish.
Varnish.
So
do you use varnish? Do you use trays? Do you use foam? Do you use gel? What is your after a kid comes in for a cleaning?
Oh, so that's a good question. So for safety reasons, every kid 4 and under, I always use varnish, because it's really, really hard to overdose on fluoride with varnish because you have that controlled amount. I think there was a death in the 70s with a 4-year-old who got overdosed on fluoride because the assistant used too much and they died. So yeah, that's the important thing to train your staff, is say, hey, it's based on weight. You can overdose and you can kill a patient with fluoride. So just for safety, so I don't have to worry about maybe I didn't train an assistant properly that one day. Guess what? They're 4 and under. I don't care how cooperative they are. Do varnish. Now, you can make a strong argument to continue doing varnish forever because of the evidence that I think it's a little better than the foam. However, my personal philosophy, I like that kind of clean feeling when you're done, and it's kind of weird to take that away. So, but it's not, I'm using my Kirk emotion thoughts, not my Spock thoughts. If I was using my Spock thoughts, I would do varnish forever. But I just don't like that feeling. So I go with
know.
my
I don't like it either. I mean, you get your teeth all clean and then they feel all crunchy.
So
Okay.
I would do foam after that.
I want to tell you, I want to keep it real. Can I ask another overtime?
Yeah, no, yeah. I have all the time in the world.
Let's keep it real. They have children's toothpaste, but what percent of children in America are using adult toothpaste, and what is that really an issue? Whenever I'm in I always like it when I'm in someone else's house, see what's going on in the bathroom, and when I'm anywhere, like I was at dinner at non-dental friends the other night in Mesa, and you go into the bathroom, every toothbrush looks like it was a power sander for a construction site. All the bristles are always frayed. And if they have a bunch of little kids running around, you don't see any children's toothpaste. You just see the old bottle of Crest, Colgate, whatever. What's your thoughts on the children's toothbrush and toothpaste?
The only active ingredient, as far as I'm concerned, is the fluoride. And between adult toothpaste and kids' toothpaste, it's the same, as long as it's the fluoridated variety. So in my mind, it doesn't matter. I find most children don't like mint. So usually you switch to the kids just because it tastes better, and they don't need all that whitening stuff. But if a little kid likes mint adult toothpaste, I don't care. That's fine.
Well, hey, I just want to end on, I think you're an amazing man. I really do. I think you're an amazing
Thanks.
man. And again, on these, we put up 350 courses on Dental Town. They've been viewed like 700,000 times. And pediatric dentistry is the number one. I don't know if it's because they feel, I don't know why that is. But I think there's a lot of factors. I think the Affordable Health Care Act put 10 million more kids in the market. I think the echo boom in 2007 dropping 4.5 million kids is now at 2016. They're definitely in your office. But man, if you ever have the time to create an online C course on Dental Town, that is the hottest category in online C. I mean, and they just say over and over and over, they just need more training on all that. So pediatric dentistry, it's the hottest part. And I want to say one business thing to the listeners out there is that everybody keeps focusing on the end of the snake. I look at the demographics, the baby boomers, the snake swallowed a rabbit. The baby boomers, that big lump moving through the snake, and 10,000 a day are dropping off into senior citizenhood, and that's why you have 150 different dental implant companies and all these training. And everybody keeps looking at dental implants and all this stuff. I'm telling you, the other end of the snake is as big or bigger of an explosion than the baby boomers retiring. And so many people that tell me, ideas to grow their practice, they don't even do pedo. And that's my last and final question with you. Do you think when I was little, all the OBGYNs were men? And now that I'm 54, they're all women. I see most pediatric dentists these days, you can go into a school where they have 6 residents and they're all women. Is you being a man pediatric dentist, is that fading away? Are you in a profession that's turning like OBGYN to an all-female profession?
Oh, it's definitely males are in the minority now for residents, what I see. Although I have 3 daughters, there's pink at my house all the time. I like musicals. I'm pretty much feminine anyway, so it works out for me. But
well, Bono just got Woman of the Year. Did you see that?
No,
and his wife said she always likes a little man in her woman.
So yeah, I have no masculinity left. But it's just it's definitely women definitely have a lot more empathy skills, and that makes sense. And and working with the kids works well for them. I like it too. I don't think it's black and white. There's still guys out there that obviously enjoy it like me. So
yeah. Okay. Well, man, what a fun hour. I love your message, prevention over drill, fill, and bill. I mean, gosh darn, if you guys can listen to this and prevent 1,000 cavities, that's why when I graduated in 87, and the first 2 years I blocked off every Friday and just worked on water fluoridation because I thought, well, it's so dumb to sit here and drill, fill, and bill from age 25 to 75 when you could have prevented more. And I really felt that when me and Jack Dillenberg and a hygienist named Kathy Smith, and there were 7 of us. It was 2 dentists and 5 hygienists. That when we fluoridated Phoenix, I felt like I had already done more dentistry that I could literally retire, walk away, and go home and say, you know what, I did my job. And every fireman spends far more time going over to buildings and checking their sprinklers and checking, preventing. I mean, if dentists would be like firemen and spend all their time preventing instead of putting out a house fire. And man, I love your prevention. And it's also the most important. I care more about my 4-year-old granddaughter than I do about my 4 boys. I mean, because that's the future, And so I love your message. I hope you get a course up on Dental Town sometime. Thanks for all you do for dentistry.
No, thanks so much. And if anybody, I do have bulk rates available. I have a lot of dentists that hand out the book, so I can maybe send you a link for that. And I'm donating 100% of my profits for my book sales this year in 2017 to Healthy Smiles, Healthy Children. So, I'm just really trying to get them.
You didn't talk about your book.
Oh, I didn't? Well, I had to do the one pitch at the end. So, yeah, More Chocolate, No Cavities. If you want to buy 1 copy, go to Amazon. If you want to buy 10 copies, email me, and I'm on thedentistdad.com, or maybe I can give you a link. I give you a discount for buying.
No, don't give them a discount. They're dentists. They make $175,000 a year. Make your money back. So what's your email?
The email is Roger at thedentistdad.com. So that's Roger.
So you send the order to Roger at thedentistdad.com and then send the money to Howard at dentaltown.com.
Yeah, just email me. I'll send you a coupon code and where to go if you want to buy. I've got people buying like 100, giving
Ryan,
out to
can
patients.
you push this book out on all social media? I'll put this. I'll post this out. It's called More Chocolate, No Cavities: How Diet Can Keep Your Kid Cavity Free by Dr. Roger W. Lucas, DDS. A manual to avoid surprise cavities without changing your lifestyle. You can buy one on Amazon, but if you want to buy more, so this is something. How much is it if in the bulk rate? How much is it per?
It's 60% off, so it's like $13 on Amazon, and it's probably about like $6.
So do you give these to families? Is it a practice builder, or do you sell it to your parents?
At first I thought I shouldn't give it away for free because I want people to appreciate it. But then I had a bunch of dentists just buying tons to give out. So I'm giving it out to all the new patients. I don't want to. So they seem to appreciate it. I know not all of them are going to read it, but the ones that are interested, it's really helpful. I've had patients I do surgery on, and then they read the book. They go, "Wow, this is so helpful. Thank you for teaching that to me."
Okay, but now that we said the name of your book, which is More Chocolate, No Cavities, there's definitely many listeners wondering, are you serious, dude? What do you mean more chocolate?
So there's a study done in Chile in 2014 that looked at whole milk versus skim milk on a tooth slab with Streptococcus mutans. And the whole milk did not lower the pH below the critical pH of 5.5, whereas the skim milk did. So concentration matters when it comes to cavities. And of course, if you added sugar to the whole milk, then it did. So, and dark chocolate has a less concentration of sugar as whole milk. Think of like dark chocolate, like peanut butter with a little sugar in it. You get that. You have to have a certain percentage of sugar before it starts to be bad for your teeth. Now, I'm not saying eat dark chocolate all day, but eat dark chocolate. Dark chocolate is better for your teeth than a dried fruit snack or a cracker. And it's based on the biochemistry and the concentration. So I tell all my parents, if you're going to have a treat, eat dark chocolate. Don't feel bad about it. It's like a superfood for your teeth. Yeah.
All right. Well, we will. Have you posted that book on Dentaltown?
No, I'm not. I'm trying to get back into Dentaltown.
We'll post it under. Do you want to? Is most of the dentists buying your book pediatric dentist?
Yeah, I think most of them are pediatric dentists.
Let's post that in the pediatric dentist forum. Dentaltown, that is actually, we have 50 forums, and the pediatric dentist has the highest percentage of the specialists on the forum. Orthodontist is the lowest because they're over on Orthotown. But pediatric dentists, there's so many pediatric dentists that answer questions and debate on that. So we'll post that under the pediatric forum town right now.
Well, thanks so much. Yeah, thank you so much. It was an honor to be on your show, Howard.
Oh, thank you, Roger. You're amazing. Talk to you later.
All right. Thanks.
Go Cardinals.
Go Hawks.